Rectal bleeding may be minor, as when you see a small amount of blood on the toilet tissue after a bowel movement, or a few drops of blood in the commode. However, bleeding can also be heavy. Bleeding can also be associated with pain. If the bleeding is minor and intermittent, you can schedule an appointment to see your doctor to be evaluated. However, if the bleeding is heavy, you should be seen soon, even if you have to go to the hospital emergency department. Remember, don't panic. Most causes of bleeding are benign. Nevertheless, it needs to be checked out. Most common causes of bleeding are hemorrhoids, fissures, or polyps. Hemorrhoids are small sacs of blood vessels found in the anal area. They can become inflamed and irritated and can bleed. Fissures are tears in the anal lining that also can cause pain, and pain in the rectal area can be scary as well. Bleeding can come from more serious conditions, such as colon polyps and even cancer. Bleeding can also occur from inflammation of the lining of the intestine. And these are more serious conditions that also need to be checked out. Your physician will likely ask you many questions to determine the cause of the bleeding. You will also have a physical exam of the rectum and anal canal. This may include an examination with a small scope called an anoscope, which is lubricated and inserted into the anus. If you have pain, the doctor may recommend an exam under sedation so as not to hurt you further. Your doctor may also recommend a colonoscopy, which is an exam of your entire colon that's done under sedation. If the cause of bleeding is from hemorrhoids, the treatment is often simple and may include dietary modifications, medications, or even minor office procedures. If the cause of bleeding is a more serious condition such as cancer, this can be treated and often cured when found early. Remember, rectal bleeding is not normal, but don't panic. If you have rectal bleeding, visit your primary care doctor or see a colon and rectal surgeon and get checked out right away.